So the purpose of this video is to give you guys a little bit of an idea of what you can expect from your skills kit for nursing. A lot of it is going to be, I've already did like a quick tour, but it's going to be a lot of the things that we'll use for simulation lab, a lot of the things that we'll use for clinicals, some practice tools as well that we'll have. And I just can't wait to show you guys this. So this video can help anybody that's in nursing school, thinking about going to nursing school, a CNA. If you are interested in healthcare and you want to take it all the way, stay tuned. Because yeah, this is gonna be my unboxing for the skills kit. Make sure to subscribe, like, comment, all that good stuff. Let's get into it. Ooh, what is up, YouTube? It is your boy Zed back at it again with another video. Today I did my orientation for school and I have a packed video for y'all. This is not like a litman or anything. This is just something that I got and it was included within the skills kit. Yeah, today we did the orientation, learned a lot, went through a lot, but in this bag, I have a lot of stuff that was included in the skills kit. When I purchased the skills kit, I never thought it would be this much stuff, but I'm guessing, you know, with simulation lab and clinicals and everything, this is stuff that we will need and use. So they put it into this blue bag, you know, nothing too crazy, nothing too major, but I'll sit it on this chair because it just makes it a little more convenient. But all right, I guess we'll start with the main thing, which I've already did a little tour already, and it's gonna be this stethoscope. I couldn't say stethoscope. So it's just a little, in my opinion, cheap stethoscope. I think it's just something that we can use for simulation lab and to get acclimated with a stethoscope. I know a lot of people already enter school with their own stethoscope. I plan to also have a stethoscope by that time. Apparently, you know, I'm getting one from either my mother or Bree for Christmas. So I'm excited for that. I already told them what kind of litman I wanted to get. It might be the Echo, it might not, I don't know. But I'm able to use it for school. So it's the Acoustica stethoscope. Handcrafted, lifetime warranty, free parts for life. Decent stethoscope. Me and Bree already use it. We listen for lung sounds and we listen for bowel sounds already. So something cheap little stethoscope. Like I said, MDF, really, you know, in my opinion, it's sturdy. You know, I can see myself using this just to get my practice in, because the Echo is noise cancellation. So I plan to be able to kind of get acclimated with hearing all the sounds with this and then letting the Echo be like a extra, you know, thing. Let it be in its own practice, and it'll make it a little easier for me to hear some of those sounds. But the next thing is the biggest thing that's in here, which is, it looks like PPE. If you haven't already know, I am a CNA. So I know a lot already from working on cardiac, from working on neuro, home. And I've worked on a bunch of different floors and I've seen a bunch, but yeah, it's PPE, personal protection kit. It includes a yellow isolation gown, both Fonot cap, just a cap, face mask, vinyl gloves, and shoe covers. These shoe covers might not even fit me because I wear a size 14, so we'll see. What else do we have in here? Looks like all I see in this thing, and we'll get through this quickly because I don't want this video to be too long. Alcohol prep pads. I don't know if you guys can see that. Alcohol prep pads. It's a lot of stuff in this. Suction catheter kit, which is I guess it's for trachs. I've seen them use this for trachs, so it could be for trachs. Some surgical sponges. It's just regular stuff. More suction catheters. A lot of times with trachs is they'll need to get whatever gook or let me start using real terms. Kind of like stuck saliva, basically, and they'll use that to suction out the trach and clear out the trach so the patient can have an easier time breathing. A lot of times patients will cough and it'll like kind of spit out of the trach, which I've seen is kind of disgusting. It almost hit me in the face one time too, but you know, it is what it is with that. Nothing too major. This is a digital thermometer, which I don't know why they have a baby on there, because they have a rectal thermometer. You know what I mean? I'm not sure if this one is. Have some scissors. And I'm not going to dig too much into this bag because it's normal stuff. Let's get into the fun stuff. So I'm pretty sure we'll be starting to use this maybe the first week of school, second week of school, whenever we get ready for simulation lab and all that good stuff. But yeah, that's it for this week. Next, we have a Pocket Nurse Simulation and Education. This is a pre-connected closed system, Foley catheter. So if you are a CNA, or you've been a CNA, or you follow some of the stuff that I talk about on this channel, you would know what a Foley catheter is. It's simply a tube that is placed for a patient to get direct access to their bladder to clear out their bladder. You get what I'm saying? If they're having a hard time peeing, they having a incontinent of urine, or they cannot pee on their own, a lot of times they would either put a if they have to go an internal Foley just to help the patient relieve the patient's bladder and clear out, you know, whatever they need to clear out. And oftentimes they'll pull it out and see if a patient can pee on their own, you know, on a later date, a later time, a later week. You know what I mean? They'll give the patient time to pee on their own. And I've seen a lot of times where they take Foley catheters out and the patient still cannot gain access or gain control to be able to pee on their own. So they got to do an in and out, which is it's an intervention for a patient, but it's a quick in and out. So they would insert a catheter, clear out the bladder, and then get some back out. A lot of times I would see this with patients on, I want to say patients on my floor. I work on a cardiac progressive floor. So patients on my floor, you know, I see Foleys all the time. You have to do Foley care as a CNA. I've mentioned that on other videos too. So if you haven't already seen it, go check that out. But next on the list, we have a pumption infusion set. So I cannot wait to learn about IVs. So I work on a floor where a lot of nurses are helpful. A lot of nurses have been helpful to me, and they oftentimes tell me a lot about IVs and stuff like that. You know, how to flush an IV, how to put on an IV. And I also ask a lot of these questions. I go out of my way to ask these questions. So I'm really excited to learn about IVs, be able to control IVs on my own, and learn like how much to infuse and, you know, where to infuse and what medicines to infuse. So I'm super excited about that. Pharmacology is like a class that I know that I want to really hone in on. I mean, all of it I want to hone in on. Don't get me wrong, but pathophys and pharmacology, I really want to like really master that. You know what I mean? I want to really understand it, really grasp the concepts and do very well, because a lot of times, like, you're not going to know every single medication, but I want to be as knowledgeable as I can with it, because I feel like that'll make me a better nurse. I feel like it'll make me, you know, less likely to, you know, commit a med error, and protect my license and just be the best nurse I can be. I want to be a competent nurse. And I feel like knowing your medicines, knowing, you know, your pathophysiology, how it affects the body, how it affects the patient, the side effects, it makes you a competent nurse. And that's exactly what I want to be and how I want to be. So yeah, really excited for that. Really excited for that. Next on the list, we have sterile water. A lot of times this is used for irrigation, but this is sterile water for injection. So I'm not sure exactly what that's used for, and I know I'll find out. Next, we have dextrose, and this is all demo, by the way. Like, none of it is actually really some real stuff. It's really just a fake, basically. It's to prepare you to really deal with the real stuff during clinical and everything else. But this is dextrose and colorant. I don't believe it's really dextrose, you know, but can't wait to use that and see, you know, how we go about that. The IVs is going to be really fun for me. We got another secondary set, just IV stuff. Moving forward, we got sodium chloride injection. I mean, just regular stuff. Normal saline. More IV stuff. This is cool. All right, we got a trach care kit. So I'm not gonna open it. I thought about opening it. I'm not gonna open it, but it's just a trach stuff, which I mentioned before. Dealing with trach, trachs, there is a bunch of stuff that you have to do with it. You have to clean it. You have to suction it. A lot of times they connect air tube through it with oxygen flowing, so it makes it a little bit easier for them to breathe. But I like trachs a lot. And on my floor, I deal with it every so often, not so much. I feel like I dealt with it more on neuro because they probably don't have that function for themselves. But yeah, I want to do the hard stuff when it comes to nursing. I want to challenge myself. We got another Foley catheter kit. And this is also some stuff that you can expect in yours. Just IV, another trach. I believe it's more so repetitive stuff. Okay, cool. Here's something. A demo dose. Can you see it? It looks like, I know what it is already because I've seen it before, but it's just a fake skin. So you're going to practice, you know, with syringes and sticking patients. Except you're not sticking a patient, you're sticking this thing. Maybe sub-Q because it's not really a muscle, you know what I mean, under the skin. But yeah, I think that'll be absolutely something that I use and have fun with as well. Next, we got dressing change tray. A lot of this is all the stuff that's going to be used on a mannequin. A lot of stuff that's going to be used on a mannequin. And I'm really excited. I'm really excited for sure. We're almost getting to the bottom of this, and then I'm going to talk about my expectations for this semester coming up. Irrigation tray. Again, I'm not sure exactly what a lot of this stuff is used for, but I've seen it just from being in nursing and working on my unit and being around all that stuff. I see this stuff all the time. We have a pen light, scissors, and sterile water for irrigation. So I think that wraps it up for the skills kit portion. But from having orientation today, I do know that it's going to be a very, very massive obligation. I'm not going to say nursing school is easy. I'm not going to say that it's not doable. But I do know that it's going to be a big obligation. It's going to require me to have a lot of time. My expectation for you guys is to post as often as I can. Even if that means Bree has to take over my channel for a little bit, as in like doing the recording and the editing for me. But I want to make sure that I get content out for you guys. So, you know, my multiple drops a week might turn into once a week, once every 2 weeks. I don't want to. I'll gauge it, you know, even if it just means I got to come up here and talk. If you guys want to hear more videos from me while I'm in nursing school, just let me know, because I don't have to edit them as much. I can come up here and really just study with you, chat what I'm learning, all that good stuff. And I think that'll be enough. Don't expect me to record at any site. Don't expect me to record while on campus. You know what I mean? I'm never going to record at any place because I don't want to implement myself with a lot of these things that's going on. I don't want to put myself in trouble. I don't want to put my school in trouble or anything like that. So I will never record at any site. It'll either be in my car, on the way home, here. So that's where you can expect the videos to come. But I'm still down to answer any question that you guys have. But I'm expected to be competent. I'm expected to be locked in, and I cannot have any major distractions, which is why I'm cleaning up my schedule now, cleaning up my obligations now, letting it be known that I'm in nursing school to all my friends so they don't ask me to do too much, my family as well. So, and Bree knows as well. So she's excited. She's excited for me to start. So I'm really excited to, you know, put you guys on game, teach you guys what I can. And this is going to be a good year, good semester. Let's start with this semester. It'll be a good semester. I just know that when it comes to nursing school, I have a lot of anxiety, but there have been other people who have made it through this program with much bigger obligations and much bigger responsibilities than me, where it's just me. I don't have any kids. I have a girlfriend, but you know, I don't have any major responsibilities that's taking time away from me studying, taking time away from me, you know, potentially working a little bit. You know, we'll figure that out as time goes on. Maybe YouTube will, you know, take over my bills while I'm in nursing school. We'll see. But I'm expecting to do well. And if you want to support the kid, Cash App is going to be in the description below, because I've had a lot of expenses for nursing school already without, you know, any aid or anything like that. So, yeah, go ahead and drop something in the Cash App for your boy. Also, I have merch you can go purchase. That'll also be in the comment section below, maybe in the description below. But if you can't do that, or, you know, support the channel in that way, you can always support by liking, commenting, subscribing, sharing. That also gets me more too, because this channel is monetized. So yeah, I really appreciate everybody for watching this video. I have so much more on the way, so much more on the way. And I cannot wait to, you know, explore this journey with you guys, bring you on this journey with me, because y'all seen it when I started as a CNA. Now I'm starting school, actual school, instead of just doing prereqs, which is what I was doing for a while, pre-nursing, whatever. Now it's full live nursing, and this is going to be a 12-month ABSN, because I already have a degree. But yeah, I think that's all I have for y'all in this video right now. Go ahead and like, comment, subscribe. Follow me on the gram at IZLERY. I'm trying to get monetized there as well, just from posting reels, and I'm going to start posting. I told myself when I start nursing school, I'm going to post content on there. That still has yet to be seen, but that's the plan. And I can monetize that content as well. So tap in. I appreciate you guys for watching. That's all I have for y'all in this video. All right. Peace.